We have a very special guest here from John Hopkins. Could you please introduce yourself? And
Hi, I'm Alain Labrique from Johns Hopkins School of Public Health, and I'm also the director of the JHU Global mHealth Initiative.
We'd like to welcome you here in Stockholm. Is it your first time here in Stockholm?
It is my first time. It's a lovely city. Thanks for having me.
How do you find the conference so far?
It's very interesting. Yesterday was a very Scandinavia-focused, and today we're hearing a lot of global health, and so it's been an interesting mix of the two.
How do you find the different experiences between Scandinavia and, for example, the U.S.?
So I think there's a lot of innovation that's happening. Unfortunately, as we attend these various meetings around the world, we see that we still tend to be somewhat focused in silos of innovation. And as much as we'd like to think the internet and other aspects of social media should be democratizing innovation, we still see that there's ample opportunity to share things that are being developed in other parts of the world. And like I said this morning, there's often innovation that's happening in the developing world that we could learn from and be inspired by, even here in Stockholm.
So you talked a lot about mHealth solutions. Why mHealth?
So I think one of the things that we realize is there are nearly as many mobile phone connections on the Earth today as there are human beings on the planet. So that's a natural opportunity for us to think about leveraging that reality to improve the way we deliver care and really democratize access to information, health information, for people who 5 to 10 years ago did not have the ability to look up information about proper health care or how to manage a complication during their lives. So it's those simple things that we can now do using mobile telephony that have really the potential to transform health systems.
Could you give us examples about projects that really made a difference?
So one series of projects that I think are very important to study is that of bolstering supply chains. So as you may know, in some parts of the world where getting essential commodities and drugs to remote locations, remote clinics, is often challenging. Knowing when your supplies are low is something that is always a challenge. But now through simple text messages, frontline pharmacists, frontline clinical providers can send that information on a daily basis, allowing central stocks management systems to resupply those clinics before there's an emergency. Another area where there's also a lot of promising data is for adherence to drugs. So as you know, as human beings, we're very bad about taking our medication when we're supposed to, but simple reminders by a text message to patients can help them to stay on track when it comes to essential drugs that control diabetes or even HIV. And so we're working on projects which help TB patients monitor whether or not they're staying on track with their drugs. But we're also working a lot with governments. So helping governments in countries such as Bangladesh develop national vaccine programs that can enable a parent or a doctor to look up the child's immunization history and make sure that that child is getting the right vaccines at the right time.
Well, with all the advantages of mHealth, some people always worry about security when it comes to mHealth. What are your reflections towards that?
So I think it's a very important point.
Yeah.
And I think data security is critical. You have to understand that the ownership of information always starts at the individual who generates that information. So making sure that data is not compromised is something that we should make the best possible efforts to do. However, I think in some conditions we can implement such rigorous layers of security that you start to have a counterproductive effect on what benefits you could derive from the technology. So I think it has to be a balance between the two.
Finally, I'd like to know what are the countries or the continents where you actually operate?
So I personally do a lot of work in South Asia and Sub-Saharan Africa. I think those are places on this planet where there's a lot of growth and a lot of acceleration in this space. But we have partnerships with universities and research institutes here in Europe as well as in North and South America. I think part of the the enjoyment of working in the mHealth space has really been the interdisciplinary collaboration across institutions, governments, and scientists and innovators that makes it so interesting to continue operating in this space. So meeting people like yourself, it's been a real pleasure.
It's been a real pleasure. What are your hopes for the future of mHealth?
I think in mHealth we've seen 3 or 4 eras so far, and it's only been around for 5 to 10 years. And it started with this era of experimentation and piloting ideas, and that moved to an era of collaboration where the leading innovators in the space began to talk to each other. And I think we're entering into that third space where we're looking at integration and scale. So we're starting to see some of the best ideas begin to take on a scale where they're being adopted by entire countries. So we heard today about Rwanda. We're working closely with the government of South Africa, which has now rolled out a nationwide mHealth strategy. So I think we're gradually entering into this era, hopefully across many countries, where we'll be able to see mHealth innovation, but at scale, so at a national level. And then the next thing that we're looking for is transnational communication, so where countries can exchange information and data, because as we know, many of the populations in South Asia and Sub-Saharan Africa are mobile. And by that I don't mean they just have a mobile phone, they actually move a lot from country to country. And so enabling them to have continuity of care, no matter where they are in the world, is something that is an aspiration that we're slowly working towards.
Let's hope it works.
Yep.
I'd like to express my gratitude to the fact that you came here, and I hope you enjoy Stockholm and the rest of the conference.
Pleasure. Thanks so much.
Thanks a lot.
Yep.
And my colleague Dina is now going to take over, so stay tuned.